Hello, this is Emily Henke, the Equity and Engagement Lead with the North Sound Accountable Community of Health, or North Sound ACH. Thanks for joining us today as we discuss how North Sound ACH is pursuing equity in health system transformation with Professor John Powell. North Sound ACH is one of 9 accountable communities of health in Washington state. We are a regional nonprofit organization working with multi-sector partners to transform the systems that impact health. The North Sound region includes Island, San Juan, Snohomish, Skagit, and Whatcom counties, and 8 tribal nations, the Nooksack, Lummi, Upper Skagit, Sauk-Suatal, Swinomish, Stillaguamish, Tulalip, and Samish nations. The North Sound ACH has committed to using an equity lens in our work to look upstream for ways that we could impact health without waiting for illness. And we have required that our implementation partners embark on a journey of learning about tribes and equity. Today we'll be talking with Professor John Powell, one of the experts who have agreed to do this vital work with us. Professor John Powell is an internationally recognized expert in the areas of civil rights, civil liberties, structural racism, housing, poverty, and democracy. He is the director of the Haas Institute for a Fair and Inclusive Society at the University of California, Berkeley, a research institute that brings together scholars, community advocates, communicators, and policymakers to identify and eliminate the barriers to an inclusive, just, and sustainable society. At Berkeley, Professor Powell holds the Robert D. Haas Chancellor's Chair in Equity and Inclusion and is a professor of law, African American Studies, and ethnic studies. Professor Powell is well known for developing the frameworks of targeted universalism and othering and belonging for use in equity-based interventions. As part of our work to advance equity, North Sound ACH has engaged Professor Powell to provide us with guidance in implementing targeted universalism and exploring othering and belonging. In January of 2019, Professor Powell joined me, Emily Henke, North Sound ACH Equity and Engagement Lead, for an interview about how we can apply these equity frameworks in health system transformation and in our own nonprofit organization. We're sharing that interview with you today because what we talked about is relevant to any group working to advance health equity. So John, people will be hearing the term targeted universalism today and as we work on advancing equity throughout our regions. Can you give us a brief background on the concept of targeted universalism?
Yes, so targeted universalism really comes out of the work around equity, and I sometimes refer to it as equity 2.0. But when people focus on equity, they almost always focus on disparities almost exclusively, and therefore it becomes a zero-sum game. Like a dominant group, whoever that is, has something, and the less dominant group has less, and how do we close that? That's not really what we're trying to do. What targeted universalism is doing is saying, what is the universal goal that we're all trying to achieve? And you have to be explicit about that, and there has to be some process of developing that goal. And then you say, how do we achieve that goal for each group based on how they're situated within structures and within culture? And so one group may already be there or close to there and have a number of structures that support them getting there. Another group may be a long ways from there. Mm-hmm. So to give you an example, I worked with a group in Portland and around home ownership. And within the white community, home ownership was less than the national average, around 66%. The national average at the time was 75%. Among Native population, which I was working with as well, it was about 25%. So we actually created a goal of getting to the national average for every group. So for the white population, it meant about a 9-point move. For the Native population, it meant a 50-point move. And it can't be the same move. It needs to be different processes for getting there. So target universalism is saying, let's have a universal target, and let's have, a universal goal, and targeted strategies to get there based on how groups are situated.
Is there an example of the different strategies that worked in that program for the different groups that you could provide?
Yeah, I don't know about that particular one, but there are a number. So one of the things that's sort of very interesting is that in terms of understanding people's situatedness, it's not just aggregating individuals. So a great example might be looking at schools. So there's a concept of high poverty schools which generally about 50% of the students are below or eligible for free and reduced lunch. When that happens, the overall stress on the school goes up. And you're more likely to be dealing with schools that are populated by students of color. So you might say, well, we have these programs where we give a school extra money or extra resources for each child. When you have a school with concentrated poverty, that doesn't work, because at some point it affects who the teachers are. It affects the curriculum. It affects the trauma in the school. So it's not just it's not like saying per capita. We're going to look at how many kids are needing free and reduced lunch in one school compared to another school and just make that intervention. Because what happens is you're looking at structures themselves, and the structures in high poverty schools are actually quite different. And the need is also quite different. So you need a very different assessment. And oftentimes the culture is quite different. And so in urban areas, most white children go to low poverty schools. It's not so true in rural areas, but in urban areas, even kids of color are likely to be in high poverty schools. The single most important thing in terms of learning is the experience of the teacher. And if you look at where the most junior teachers are, they're in high poverty schools. So you take the schools with the greatest need, the fewest resources, and give them inexperienced teachers. So people oftentimes talk about an achievement gap. It's more accurate to talk about an opportunity gap, because we structure things differently based on needs. So there are a number of examples like that. I'll just give you one more. The CDC was looking at sexually transmitted disease. And when they studied black and white children, teenagers who had basically the same sexual habits as individuals, but they found that the sexually transmitted disease was quite different. And for a while it sort of threw them for a loop. It's like, well, if their behavior is the same as individuals, their outcome should be the same. The difference was how they would network. And so, and a network is basically who you know, who your friends are. And a thin network would be if you have A knows B and B knows C and C knows D, but D doesn't know B. And so each one sort of knows two people in the network. That's a thin network. A thick network is where everybody knows everybody. And what they found is that in terms of disease, not based on individual behavior, but based on network, a disease will travel much faster. And so if you're analyzing what to do, you need to be aware of the network people are in. So that's a different situatedness that you don't get to by just looking at individuals.
So you described targeted universalism as equity 2.0, and I've heard you describe it as a step on a larger journey from equality to equity to targeted universalism and onward. And I was wondering, does everybody have to go on that journey, or can we learn from the journeys of others? Do we need to start with learning about equality in our regions, or can we start talking about targeted universalism?
I think, so targeted universalism is both a practice and it's also a communication strategy. And it's actually, when we talk about equity, a lot of the ways people understand it is, again, disparities. If you achieve targeted universalism, you address disparities. So disparities, that's not unimportant. But when we just focus on disparities, people see a zero-sum game. It's like the dominant group has too much, the marginal group has too little, we need to take something from the dominant group. And that creates what I call the breaking discourse. People then start competing, not cooperating. When people think about equality, people think about treating everybody the same. And you know, it's interesting, in Western society, the concept of equality comes from Aristotle. And Aristotle understood that there was what he calls arithmetic equality, which is where you treat everybody the same, and geometric equality, which you don't treat everybody the same. And his idea of geometric equality was that it's fair to treat people differently who are situated differently. And so it's important for us to get away from that formalistic idea of I treat everybody the same, when everybody's not situated the same, geographically, biologically, in terms of groups. So it's that old expression that we don't allow people to sleep under a bridge, whether they have a house or not. I lived in Florida for a while, and they passed a bill, ordinance, saying you couldn't urinate on the street. That's for everybody. We're treating everybody the same, except if you're homeless or don't have a house, where do you urinate? So we actually need to deepen our understanding of equality, and that's what equity moves toward. And targeting universalism moves us even further, because targeting universalism is about belonging. It's a process to say that yes, everybody belongs, everybody has agency, and everybody are situated both in culture and in structures. So because we're a society that tends to be individualistic, we're a society that don't see structures, we start with equality, but it's not a good place to stay because it actually creates blinders. We don't understand how structures are actually defining people's lives, and not just marginalized people, all of everyone. Structures matter, and we need to pay attention to them.
What is the difference between inclusion and belonging?
That's a great question. The name of our institute is called the Haas Institute for a Fair and Inclusive Society. And we're in the process now of changing our name. Because the way people understand inclusion, and I just gave a talk for Dr. King's celebrating his birthday, and he had this conversation with Harry Belafonte, where he says, I worry that I'm advocating for integrating people into a burning house. That's inclusion. Inclusion is basically saying there's a structure there, there's a culture there, and we're going to bring people into it. But it's already there. And also the people who are coming in oftentimes come in as guests. I sometimes use the analogy that I'm having a party. I invite people to my party, but they can't start messing with the furniture. They can't say, I don't like that wall. And at the end of the day, they should leave. They're there as a guest. So inclusion, whether it's included into a school system or a healthcare system or a housing system or a political system, someone else actually designed it. And those designs always carry certain values associated with it. Maybe it's fine. But belonging basically say we co-create the thing that we belong to. So it's not my thing, it's not your thing, it's our thing. So I have agency not just in terms of showing up, not just in terms of representation, but in actually helping to not just be at the table, design the table. Maybe I don't want a table, So belonging actually is much deeper. It's saying the thing that we're going to belong to does not already exist. We get to co-create. We collectively get to co-create the world that we live in. It's not just given to us. Whereas inclusion is the world or the structure is already there, and you just are invited to join it.
Thank you. On the topic of belonging, I have a few questions from the chair of our Regional Voices Council, which is our board committee that is really our main conduit for reaching community members and especially Medicaid enrollees. How do we get meaningful input from community members impacted by inequities and disparities when they are busy? Many have historical traumas, many are busy dealing with many issues, and maybe feel marginalized by our structures. How do we hear from them in a meaningful way?
Again, a great question. I would say a few things. So we are moving in the right direction where we say communities should have some voice in terms of structuring their own community, and that's right. But we need to even go deeper than that because our communities are interrelated in some way. So think about climate change. It's like it doesn't matter if Seattle or Everett or Wenatchee cleans up its environment if the rest of the world does not. So in order to participate in a real way, we need certain preconditions. And oftentimes the community doesn't have those conditions. And sometimes they even need additional resources. So what are the conditions, what are the preconditions necessary for someone to effectively participate? Participation requires resources, it requires power, it requires agency. But those things are all just preconditions. They're not an end in of themselves. It's like now that I'm healthy, now that I'm well fed, when we started Head Start and then we started free lunch programs, it wasn't simply feeding children. We're saying, okay, we want children to learn, but their ability to learn is greatly reduced if they're hungry. And so you can think of certain communities as being starved. And once they're well fed, once they're well resourced, then we can talk about, can they fully participate? And part of it is, what are they participating in? I'll give you a concrete example. I'm at the University of California, Berkeley, and Berkeley has some land, and it was planning on building a second campus in the Richmond area. And it hired architects, it hired engineers, it hired marine biologists. So here's this school with all these resources and all these professors, and it's saying, when we think about developing this land, we need even more resources. And then it hired bond counsel. How do we raise the money? How do we do this? So it's like this very complicated system. So here you have all these PhDs running around saying, we need more resources in order to make a decision on the best way to develop this land. Then it turns to the community, created an environmental impact statement that was over 300 pages long, gave it to the community and said, what do you think about it? The community didn't have engineers, it didn't have bond counsels, it didn't have a bunch of PhDs. So how was the community, even though it was in the community, this land was in Richmond, so it turned to the Richmond community and said, we'd like your input. And one California endowment asked me to work with the community. And the first thing I said is that the community needs to hire the necessary resources for them to fully participate. And people were like, never thought of that. Mm-hmm. So part of the thing is depending on what it is we're involved in, healthcare, schools, development, we have to think about what are the conditions, what are the preconditions to allow people to effectively engage. And so what you set out is that if people don't have time, if they don't have childcare, if they don't have transportation, so we can say we have a meeting, think about voting. Mm-hmm. We say on national elections, Tuesday you can vote. Of course, for a lot of people it's like, I have to be at work, and my voting place is a long way from work. And the boss says, I have half an hour. I can't vote. Whereas for me, it's like, I'm taking the day off. And so we have to look at, again, what do people need to effectively participate? And it's not just participating in terms of designing something for their community, but it's designing something for all of the communities.
Mm-hmm. Thank you. Do you have any recommendations for boards, whether they be governing boards or advisory boards, about how they can become more diverse in terms of race, ethnicity, really any kind of identity from a community, going beyond every board in a community asking the same new leaders of color to please join their board? Do you have ideas about how boards can meaningfully diversify?
Yes, I think the diversity of boards, what they look like, who they represent, actually is important. And I think it's a first step, but it's not enough. Mm-hmm. Because you can join a board, and the structure of the board, the rules of the board, the expectations of the board can be set. And so you bring women into a board, but everything's already been designed, reflecting male sensibility, if you will. And so part of the thing is to be in conversation and dialogue with the very communities that you want to be part of you, and you should be part of them. So you're not simply going to them saying, come join my thing and help me do my thing, as opposed to, how do we do this together? And then again, what do you need? And it might be, you know what, that guy Robert, who created the rules, Robert rules, it's like, I'm not feeling it. Like maybe I'm a native culture and we have our own set of rules. Can we talk about how we conduct meetings? Can we talk about where we conduct meetings? Can we talk about our collective goals that we negotiate between us? Can we talk about the resources that we need? And it's sort of interesting if you think about it. So boards are disproportionately white people, educated people. And I've always thought about this. So we say we need more women, we need more people of color, and I think that's true. But if you think about nonprofit boards, that's where we recruit marginalized people. For-profit boards, where they pay you to show up. You go to a nonprofit board and the first thing they do is say, can you make a donation? It's like, well, I'm already marginal, and now you're telling me you need help as a nonprofit board. The for-profit board will take people who are rich and say, you're already rich, we're going to give you some more money. So even that is sort of an interesting structure. I sort of thought about, yes, we need more people on nonprofit board, but we also need more people, more diversity, more input, more belonging on for-profit boards, on the Googles and the Apples and the Microsofts. And once they're there, again, are the rules already set? So sometimes they're there, but their voice is muted because there are other structures, there are other incentives that say, we can't do A, B, and C. So, well, the very reason I joined the board, the very reason the board is important is A, B, and C. Well, no, we can't do that. That's taken off the table. So I think, again, part of it is trying to engage people in such a way that it's meaningful for them. And I would say you're going beyond diversity. Because diversity just means you look around the table and people of different identities that's there. But it doesn't say anything about power relationships. It doesn't say anything about design. It doesn't say anything about mission. It's just saying, okay, we have some women, we have some black people, we have some Native people, we have some, but again, the structure could be, and the culture could be totally set by someone else. So diversity, while critical, is not enough. We really need to go more to things I talk about in terms of belonging.
Advancing equity is an explicit goal of the Medicaid transformation in Washington state, and yet there are no metrics associated with it. For organizations that have made their own commitment to advancing equity, what are some tangible ways that we can show our progress? There's a risk that we achieve the other goals of the Medicaid transformation and not this one, which starts to sound a lot like the status quo. So what are some ways that we can show our progress and hold ourselves accountable?
Well, I think there are a lot of metrics out there, and it's interesting. We do a lot of stuff with numbers and metrics, and we do a whole thing around what we call opportunity mapping, and we work with communities. And we actually, because we do it all over the country and even all over the world, we want some things to be relatively constant. So there's some things we want to look at when we go from one community to the other. But those communities don't necessarily care. So we always ask them, what do they need in terms of metric? What are they interested in? So, and sometimes it's completely surprising and also very informative. To give you an example, there was one community that asked us to identify the number of liquor stores in the community. That was their interest. It turns out that was very important. It turns out that liquor stores, this was in Minneapolis and St. Paul, liquor stores in the Black and Latino communities were also very close to daycares. And had a number of cascading negative effects. And no one actually, it's like all the researchers come in with their own idea of what they wanted. And so I think there are some things in terms of metrics that, for example, you can look at any number of issues in terms of child morbidity. You can look at, obesity. You can look at, and it's useful. I talked about disparities. It's useful to look at disparities, but not stop there. So if the data tells us where there are problems. So if there's a huge gap, we can look at inputs, how much money people are getting, but we also can look at outputs. What's the result? And what we're going to see is that for groups that are very marginalized, even if they have the same inputs, they're going to have different outputs. And then the question is why? And if we want them to have different outputs, it's going to take some adjustment. So we can look at metrics in terms of inputs, which is not irrelevant, but it's not enough. Do they have access to good doctors, nurses, healthcare providers? We can look at the social determinants of health and say, well, this community has a lot of stress associated with trauma. In Native community, for example, the Native community still has the highest suicide rate in the country. Getting that down is important. We worked with one community in the Sacramento area, and infant death was very high. It was about 3 times higher in the Black community, about twice as high in the Native community as the white community. But the white community was also too high. So the goal was, how do you get not only the disparity smaller, but how do you get that number down for everyone? And people agreed on that. And it was interesting, it was a great example of target universalism because there was a fight, at least at some point, it's like, well, why are we focusing on Latinos when blacks really are off the chart? And forget about whites. I mean, they're the dominant group. But the people who was losing their children, they may have been part of some aggregate dominant whites, but they weren't, when you disaggregate them, rural, poor whites, they weren't so dominant. So at the end of the day, what they decided, I think they would mind me saying, the Sacramento Foundation, working with them, they decided to work on reducing the child death for all children.
That's great.
And there was a big fight because they were saying there's a scarcity of resources. Why are we taking these resources and using them in other communities? Why don't we just focus on the most marginal group? And here's the interesting thing. When you focus on marginal groups in a certain way, you really aren't just focusing on those groups, you're focusing on those structures that impede those groups. And when you do it right and change those structures, it actually has a positive impact on everybody. And in this case, they decided not to just focus on the black community, but to focus on the conditions with overrepresentation, overinvestment in the black community. And they had insufficient resources. And when they focused on the entire community, the resources poured in. So the resources are not static. And part of how we frame this actually affect the ability to generate resources. And they reduce child death dramatically, most dramatically in the black community, but even in the Latino and white community. And it became a success, and people were very proud of it, and had a real impact. So again, sometimes we think just in terms of one group, but really target universalism is not focusing on one group, it's focusing on all the groups. And it's also focusing on the structures that those groups live in and the culture and story. The culture and story is partially how we explain things. So if you say black women are more likely to have infant mortality in their families, one story is that they don't care as much about their children or they're not being neglectful. That story says we shouldn't do anything, or if we do anything, we should fix black women. We're not looking at the structure that's actually producing it. What we found was that a lot of the deaths were caused by essentially mothers rolling over at night, smothering their children because they didn't have cribs. And so they had a program where they had a story, culturally sensitive story, but they also made cribs available to every woman that gave birth. And again, it was just an incredible positive success.
Thank you.
You're welcome.
We thank Professor Powell for sharing his expertise and time with us, and we thank you for watching. If you have questions about North Sound ACH's work to advance equity, please feel free to reach out to me. Bye.